Hey there, leading ladies. Welcome to the Women Physicians Lead podcast. I'm your host, Dr. Lisa Herbert, a two-time best-selling author, speaker, family physician, and executive leadership coach with over 20 years experience of providing primary care and serving as a healthcare leader. If you are a woman physician ready to make a change in your career and have a seat at the leadership table, then you are in the right place. I'm excited to provide you with the crucial skills you need to be a successful leader and strategies to deal with workplace challenges. So put on your headphones and listen as we explore the new world of building women physician leaders. Hello, and welcome back to another episode of the Women Physicians Lead podcast. So I'm excited today to bring you another board member. And today I'm going to be speaking with Kweku Awotwi. So we just talked about the pronunciation of his name. So I wanted to make sure that I got that correct. And I got a thumbs up, so that's great. So we are here today at the 75th anniversary for the National Medical Fellowhips Gala event, and it is titled Reimagining Healthcare, Celebrating Equity Change Agents. So Kweku comes to us from Ghana, so we're really excited to have someone bring a global perspective to NMF. So I'm going to read his bio, and then we're going to get into some questions. So Kweku Awotwi is the board chairman of United Bank for Africa Ghana, the Multimedia Group Ltd in Ghana, and the nonprofit Sports for Development organization. Playsoccer Ghana, which he founded in 1999. He has been the past board chairman of Stanbic Bank in Ghana and Ghana's Volta River Authority, and served on the board of several organizations in Africa. Kweku started out his career as an electrical engineer, designing integrated circuits for telephones and TVs. After his MBA, he spent his career in the mills, mining, and energy industry, mostly in Africa. Most recently, he has been the executive vice president of Tullow Oil, the operator of Ghana's Jubilee fields, producing the majority of the country's oil and gas. Kweku has also been an entrepreneur and has co-founded a number of companies that are operating across Africa today. Playsoccer Ghana and Playsoccer International, of which he is a founding member, has used soccer to teach young boys and girls in at-risk communities good healthcare practice, leadership, as well as soccer skills. Over the years, it has sponsored by organizations ranging from Manchester City FC to FIFA. Kweku remains passionate about contributing and giving back to his communities in Africa, as well as in the United States. So I hope that I got a lot of those companies' names correctly as I was introducing you. But thank you so much for being a part of the podcast today. And I'm excited to be able to talk with you about your experience and what you're bringing here to the United States.
Thank you, Lisa. I'm glad to be here.
Yes, thank you. And I'm also, really intrigued about the soccer, because my son actually played soccer in high school, in middle school, actually, and high school. I knew nothing about soccer until he became involved with the sport, but felt that it always really prepared him, in terms of his ability to be a team player, as far as the leadership skills, as far as the focus. So I'm really intrigued by the fact that you're actually using that sport to help young people, build those skills as well.
Right.
So looking back, in terms of your career and sort of, where you started out, engineering, and now getting into some other organizations in your country, who or what may have been instrumental in that decision?
Right. Well, Lisa, great to be here with you, and really great to be in Miami this weekend with the NMF fraternity or sorority, if you like. I think it's a wonderful enterprise, as well, and I'm really honored that I've been invited to join their board. So, in terms of my biggest influence, I probably would say my father. He was a senior civil servant in the newly independent country of Ghana back in the 50s and 60s. And public service was really the center of his life and his career. And it was something that I suppose you could say I imbibed along the way, the idea of public service, of giving back, serving your community, serving your nation. He was a senior civil servant, and he had the opportunity to work for various heads of state at a very high level. And that was just something that I imbibed along the way.
Yeah, and that's interesting. I think that our parents, do a lot of times play a pivotal role, in our development and the decisions that we make in adulthood. So that's wonderful that you had your father as a mentor and someone to look up to. So tell us a little bit about your position as board chairman of United Bank for Africa. What does that role look like for you? What do you do on a daily basis? Who are some of the people that you serve, and what are some challenges that you face in that role?
Right. So United Bank for Africa is one of Africa's largest banks. It's in 20 African countries. It's the only Nigerian bank that has a full banking license in the United States. I happen to chair the Ghana subsidiary of that, so just one of many subsidiaries. And I've been on the boards of a couple of banks along the way. And banking and finance is really a sort of integral to our daily lives. We take it for granted in some respects, but we really need it to sort of manage our affairs. Sort of across the continent of Africa, for instance, you could say that a good majority, 50% plus in some respects, are not banked. They're not in the financial system. They're not in the formal system. They keep their money under their mattresses, literally. And it's actually a good thing to try and get them into the banking sector. One of the really interesting things that's happening on the continent now that you may be aware of is that banking is now sort of migrated to the mobile phones. You can do a lot of banking on your mobile phones. I mean, any of us can do that, but it's really taken off in Africa when a lot of people don't have access to many things. So really, as a board chair, it's not a day-to-day thing. It's really about governance. It's really about making sure that we're managing the bank properly. We're compliant with rules and regulations. There are a lot of things around money laundering. There are a lot of things around cybersecurity that we have to worry about. And, as board members, whether that's for NMF or for a bank like UBA, it's really about doing things correctly, getting your reports done properly and being compliant. And these are the things that I certainly worry about.
Yeah, absolutely. Absolutely. So really, part of it too is changing the way I think that we think about money.
Absolutely. And the world is changing, if I could say so. I mean, we're moving more to a cashless society where a lot of, we have digital wallets in some respects. Everything's going online. And I mean, what's really amazing about that is that, again, in Africa, you can be in the most rural parts of Africa and still have a phone, have a digital wallet, and you can still do your banking. But it's all about getting people into that formal sector, hopefully for their own benefit.
Hey, leading ladies, stay right there and we will be back with my amazing guests. This conversation is so good that you don't want to miss it, so stay tuned. I am ecstatic to have been involved with an organization that stands behind their vision of reimagining healthcare. NMF's constant effort in raising awareness for this community is so notable. I joined them at the Gratitude Gala this past November 5th, 2022, where there were key stakeholders, members, and supporters driving their mission forward. We hope that you will continue to help us in this mission of reimagining healthcare, and you can do so by going to nmfonline.org. nmfonline.org/reimagine. That's nmfonline.org/reimagine. Are you ready to deliver your message directly to the ears of your audience? Well, Coffee and C-Suite Conversations are mini episodes that give you a chance to do just that. We work with you to create a captivating conversation about your company and expertise and engage you with listeners who are aligned with your mission. As part of this campaign, you get a dedicated mini podcast inserted into several of our episodes. You also get a social media campaign and a file to insert on your own website. So what are you waiting for? Ready to give a voice to your brand? For more information, go to justtherightbalance.com/coffee convo. That's justtherightbalance.com/coffee, COFFEE, convo, CONVO. We look forward to working with you. Hey there, leading ladies, it's Dr. Lisa. Thanks for hanging in with me. Now back to our amazing interview.
So tell us about your role with NMF. How did you get involved with the organization? What inspired you to get involved? And sort of where does that intersection between, banking and healthcare sort of cross for you?
Right. So clearly, I'm not a doctor. I've never been one. But I have been a senior corporate executive for most of the last 30 years. And any senior corporate executive will tell you that healthcare, health delivery becomes a huge priority in the management of any organization. I was at an event yesterday by NMF, and I mentioned how I built and operated mines, gold mines in this case, in some of the remotest parts of Africa, in Tanzania, in Guinea, in Zimbabwe, at a time when HIV, this is 20 years ago, was incidence of that was over 40%. And that's just an example. And we had to find ways to take care of our employees, number one, but bring the cost of taking care of our employees down, number two. And that was a huge issue. I mean, you basically were facing the death of half of your employees, which was clearly not acceptable.
Wow.
But basically, along the way, what that makes you appreciate is how important, healthcare delivery in really underserved communities are. And you could say that the parallels that NMF is trying to bridge, whether it's in the urban inner city, whether it's in a rural African community, are pretty similar. What NMF is trying to do is provide that kind of leadership, that kind of representation, provide that support for healthcare givers to provide that kind of healthcare that otherwise would be not given. And so that mission really resonated for me when I heard it, when I first met Micheline, the CEO, and her team. And, one of the things you realize, Lisa, is that today I could be sitting in Miami or Virginia or Baltimore. You are not immune from the diseases that come from China or Africa or South America. You are not immune. The problems in the United States are really global problems. So really, it made me feel I had the opportunity to provide that global perspective to the domestic agenda that NMF has.
Absolutely. And I think you said it so brilliantly that basically what affects one affects us all, right? So it really transcends across the globe any diseases that we may face or encounter. So it really behooves all of us to get involved, right? Across the country, across the world, to be able to address some of these healthcare disparities, healthcare inequities. So at the end of the day, we all have the same mission, which is to provide accessible, affordable, equitable healthcare, and hopefully have people of different diverse backgrounds be able to do that.
That's right. That's right.
Yeah. So I'm really excited that that you're here, and I applaud you for coming, across the globe from Ghana to Florida to be here with us to celebrate this momentous occasion, but also just to be involved with the organization, um, from Ghana as well. So so when you look at the work that NMF is doing, which is at the end of the day, trying to increase the number of BIPOC physicians who will impact healthcare and hopefully reduce disparities, how important is it for us to really concentrate on that diversity, and how important is it to really have that mission move forward?
Well, look, it's critically important. I know you know the statistics. We are completely underrepresented in this country in terms of medical health. Whether it's doctors, whether it's caregivers of any kind. I mean, we are far short of the representation in the general population. And that means that we're not also getting the care, attention, even the thought in terms of medical research, because the medical research doesn't necessarily think of our communities primarily. We may be a byproduct or an afterthought in some cases. So it's critically important to support that proper representation. And without health, frankly, we're nothing. So health, in a way, is the beginning, is the touchstone, is the foundation of our well-being. So, that's why, and what attracts me to NMF, that we are trying to support the medical leaders of tomorrow, providing healthcare, and once again, providing that healthcare, not just with a domestic agenda, but with that global perspective, because you need that. So I think NMF is providing a critical role in that respect.
Yes, absolutely. And like you said, healthcare is the beginning, but it's also the middle, and it's also the end as well, right? I mean, it goes across the whole spectrum. Yeah. So I'm really excited for what is to come in terms of this, partnership that NMF is having, with you, with Ghana, with this global perspective of looking at how do we all work together to really change or become change agents as far as it relates to equity. So what are 3 tips that you could give our listeners who may want to get involved with organizations like NMF, who may be across the globe? Maybe they're not here, but maybe they're across the globe in another country. Where should they begin? What tips would you give them?
Well, it's a great question, Lisa. I would say engage, but engage at what level? I think you first engage by talking to the people in the space, the practitioners, people like yourself who are in the space, what's going on. What NMF is trying to do is provide that global perspective. And, thankfully, there are doctors all around, whether you're in Europe, you're in Africa, you're in South America. You need to sort of better understand the landscape. I mean, people will be surprised by the statistics, by the fact that there is quite a substantial health disparity in our communities. And so it's important to sort of understand that. Engage, meaning read as well. Read and understand what's going on. COVID, for instance, disproportionately affected minority communities. And health equity is very much about access. It's not just access to health means there's many things that go into that. Poor housing, poor nutrition, income, all of these things sort of feed into the lack of good health care or the lack of appropriate equity. And so these are things you need to sort of better understand as well. So those are 2 areas: talk to people, read, and really just get involved in terms of understanding the space, and learning from the people in the space.
That's great. Those are some great tips. And I think that we can all, take some tips from you based on what you just said, which is to engage. And if I could say that 3 times, engage, right? Talk to people, understand what's going on. Don't have a closed mind. Really learn about the different areas where you might be able to offer, a talent that you have or a gift that you have, and be able to change the landscape. So
some of it, the third is to be part of it, be present when there are events going on, meaning just physically be part of it and learn and speak to folks. So absolutely, yeah.
Yes, and thank you again. Thank you so much for just being a light, and for coming again all the way across the globe to spend time with us this weekend, and to lend your gifts and your talents to help NMF.
Thank you, Lisa. I'm really pleased to be here, and great to speak to you as well.
Thank you.
Thank you for listening today and for allowing me to be a part of your career journey. To continue receiving leadership support, I invite you to join our private Facebook group, Building Women Physician Leaders, at www.leadingladiesincharge.com. Until next time, take care.